Welcome to The Explainer. Today, we're diving into Cushing syndrome. It's a complex condition that can totally change how a person looks and how their body works on the inside. So let's jump right in. Okay, let's start with this great analogy. Think about your body like a perfectly tuned orchestra, right? Every little part, every hormone has a specific job to do, and when they all play together, you get this beautiful harmony. So what happens? Well, with Cushing syndrome, that's exactly it. One of those instruments, one hormone, just goes completely haywire. It throws the whole orchestra into chaos, and you start seeing the effects. Literally. So, Section 1, a body out of tune. We're going to talk about the visible signs of this hormonal imbalance. The first things you notice are often these really dramatic, physical changes that show you that internal harmony is, well, gone.
Okay, so the physical changes here are, wow, they're really striking. You see, Cushing's does this weird thing where it moves fat around in the body. It leads to what doctors call a moon face, a really round, puffy face. And then there's this lump of fat that can form between the shoulders, which gets a pretty unfortunate name, a buffalo hump. What's so strange is that while the middle of the body gains weight, the arms and legs can actually get thinner. On top of that, the skin gets super fragile and thin, and you can see these really deep purplish stretch marks. And let's be clear, these aren't just minor things. They're big flashing signs that something is seriously wrong on the inside.
All right, Section 2, the cortisol cascade. So what is the instrument that's making all this noise? We're about to identify the hormone behind all this chaos. It all comes down to one single, really powerful hormone. And that culprit is cortisol. Now, you've probably heard of it. It's often called the stress hormone. And honestly, in the right amounts, cortisol is our friend. It's absolutely vital. It helps us deal with stress, keeps our blood sugar in check, and even fights inflammation. So the problem isn't cortisol itself, it's having way too much of it. You see, cortisol is a total double-edged sword. When you have too much of it, all those helpful jobs it does, they go into overdrive and become destructive. It starts jacking up your blood pressure and blood sugar into the danger zone. It crushes your immune system, making you more likely to get sick. And yeah, it's what's behind that fat redistribution we just talked about, not to mention muscle and bone loss. It's a real mess.
Here's a little trick to remember one of the main symptoms. It's a bit on the nose, but it works. Cushing's makes you look like a cushion. That puffy, round look comes from all the weight gain and fluid retention. It's a pretty easy way to connect the name of the condition to what it can look like.
Okay, Section 3, unmasking the culprit. Now we get to the big question, the why. Figuring out why the body is suddenly flooded with all this cortisol, that is everything. It's the key to figuring out what's going on and how to fix it. So here's something really important to understand, and it's a bit of a tricky distinction. There's Cushing's syndrome, and then there's Cushing's disease. What's the difference? Well, syndrome is the big umbrella term. It just means you have the symptoms because of too much cortisol from any source. And actually, the most common cause is external, from taking steroid medications like prednisone for a long time. Disease, on the other hand, is much more specific. That means the problem is coming from inside your body, specifically from a tumor on your pituitary gland that's basically screaming at your adrenal glands to make more and more cortisol.
So if we take the medication-caused cases off the table and just look at the internal causes, the numbers are pretty stark. About 70% of the time, the culprit is that pituitary tumor we just talked about. That's Cushing's disease. For the other 30% or so, it's usually either a tumor on the adrenal gland itself, or, in some rare cases, a tumor somewhere else in the body that's gone rogue and is pumping out the hormone that tells the adrenals to make cortisol.
So, how do doctors figure this out for sure? They use this really clever test that basically checks if the body's off switch is working. Here's how it goes. They give the patient a dose of something called dexamethasone, which is basically a synthetic cortisol. Now, in a healthy body, the brain sees this extra cortisol and goes, whoa, too much, shut down production. And it does. But in someone with Cushing's, that off switch is broken. The body just keeps churning out cortisol no matter what. So if the cortisol levels stay high even after that dose, boom. That's how they confirm the diagnosis.
All right, Section 4, restoring body harmony. So once they've pinpointed the cause, the medical team steps in.
They become the orchestra conductor, and their job is to create a plan to get everything back in sync. The treatment plan always goes right for the source. If it's a tumor, surgery to remove it is usually the first choice. If it was caused by medications, you can't just stop them cold turkey. You have to taper or slowly lower the dose over time. There are also some medications that can help block the body from making so much cortisol. But no matter what the main treatment is, you always have to manage all the side effects too, like getting that high blood pressure and blood sugar back under control. That's a huge part of the puzzle.
And diet becomes the super important tool for fighting back against the chaos. Every single piece of dietary advice here is aimed at a specific problem caused by the high cortisol. You're eating high-fiber foods to help with the blood sugar, you're cutting way back on salt to help with the blood pressure, and you're loading up on things like protein, calcium, and vitamin D to help protect and rebuild your bones and muscles because the cortisol has been really tough on them.
So, Section 5, the long road home. And this is so important to understand. Treatment is not a magic wand. The journey back to health, getting that whole orchestra back in tune, it's a long haul. And it comes with a whole new set of challenges. You just can't overstate the lasting impact of this condition. I mean, look at this quote. It says that even when people are in remission for a long time, they often report feeling worse about their illness than patients with other serious conditions. The psychological toll is huge. Recovery takes an incredible amount of patience and support, because that feeling of being sick can stick around for a very, very long time. And here's one of the biggest dangers. And it happens right after the treatment seems to have worked. Think about it. You get rid of the thing causing all that high cortisol, but the rest of the body has gotten used to it. It's become dependent. So suddenly, it can swing violently in the other direction, into a state of critically low cortisol. And this isn't just a minor issue. It's a life-threatening emergency called an Addisonian crisis. This is exactly why educating the patient is, and I'm not exaggerating, a matter of life and death. They and their families have to know the warning signs for this crisis. A lot of people remember them as the 5 S's. We're talking about sudden, severe pain, fainting, shock, super low blood pressure, and intense vomiting and diarrhea. If any of this starts happening, it's a signal to get to an emergency room immediately. Getting treatment, usually a shot of cortisol, right away is the only way to survive it. And that really leaves us with this one big final question to think about. A condition like Cushing's affects both the body and the mind so deeply. So where does the clinical treatment stop and the personal healing really begin? It's such a powerful reminder of how connected our physical and mental health are. Fixing the hormones is just step one. The real recovery, healing the whole person, that's a journey that goes on long after the hospital visits are over. Thanks for joining us on The Explainer.